Welcome back. Now, up until pretty recently, when we thought about plastic surgery, we probably pictured Michael Jackson and the more extreme elements of showbiz in the US. But in the last few years, cosmetic surgery has really taken off in Ireland, and nowadays it seems like no big deal.
It is still often a major operation, though, and some doctors are concerned the risks are being underplayed. Join us today to discuss our talking point: cosmetic surgery, is it worth the risk? We're joined by Dr. Patrick Tracy of the Aylesbury Clinic, journalist Antonia Leslie, who's had a number of procedures, and Marie Loftus from the cosmetic surgery magazine Rejuvenate. You're all very welcome.
And I'm with Susan Daly, columnist with the Irish Daily Star, and I'll also be getting your calls and comments from home.
Patrick, if I can come to you first. Obviously, Kanye West's mother dying while or shortly after her cosmetic surgery has made the headlines recently, and it brings the whole thing back into focus again. They obviously are able to afford the very best in care out there. How common is it for something to go as badly wrong as it did here?
Okay, it's a very good question. The mortality rate from general anaesthesia is 1 in 5,000. In cosmetic surgery, it's better than that, because in ordinary surgery, obviously you're bringing in people from road traffic accidents, cancer cases. In cosmetic surgery, the sort of things that tend to tip the balance are, number one, people having procedures like she had done. The first thing is an abdominoplasty or a tummy tuck. Inherently, these people are fatter. They sort of are at surgical risk of high blood pressure. And knowing her ethnic background, most probably she had diabetes on board as well. I've certainly worked in the United States with people of that ethnic background where we'd have commonly cardiac arrest without any surgery. Now, you add into that the fact that she had a second procedure done. I think it was a blepharoplasty, so you're increasing your duration.
What's blepharoplasty for people?
Sorry, she had a breast reduction, didn't she? I think it was,
that's what it was.
So two big procedures back to back at the one time, you're increasing your surgical risk dramatically, because the normal procedure time...
Why was she allowed to go ahead with that, with all the factors that you're talking about? Why was she allowed to continue to have two procedures like that? Yeah,
it would... I would query that myself. Certainly, probably her operation time may have been as high as 8 hours with somebody that is obviously overweight as well. So, I don't know. It may be the fact that surgeons have done it before and got away with it, and they sort of, you know, are less afraid of doing it than somebody that may have had their hands burnt before. But it would seem to me to be an inherently much higher risk.
What you're talking about there are surgeons doing it before and getting away with it. There is a lot of fear out there about people not being regulated, particularly in this country, that you don't know who you're getting when you go to a surgeon, or you're interested in maybe in having a procedure done. Do you feel that's a problem?
Absolutely. In Great Britain and Ireland, I mean, particularly in Ireland, the lack of regulation is abysmal. I mean, really...
What would you be looking for? What would be the ideal?
OK, what we need is a couple of things. Immediately, the Irish government should set up a commission for safety and quality of healthcare. We should look at all establishments that's providing either cosmetic surgery or non-cosmetic procedures, and we have to sort of look at them in such a way that they have to evaluate staffing levels, they have to evaluate support services, they have to evaluate what sort of equipment they have. As well as that, this commission should have the power to inspect all the places, not only regulate
None of that
them,
happens
but
at the moment.
Nothing happens. We should have a kite-marked single or sort of little symbol, like the Healthcare Commission in the United States of quality control, that goes onto every advertisement, so a patient knows beforehand whether it has passed government procedures or not. And also, the last thing, which is almost the more important, this commission should have the power to take away people's licenses or their registration. I mean, this is basic in every other country. I mean, I'm not... there's other reasons why it hasn't happened.
Why is plastic surgery being treated differently to other surgery than in this country? We're hearing so much about... There's recently a survey about people arriving in who've had surgery abroad, people with botched jobs being done, having to go to the likes of yourself to get stuff fixed.
OK, well, this is the result of a survey done by the British Association of Plastic Surgeons that Rajiv Grover sort of released last Friday. And it shows that of BAPS members, 80% have treated 1 to 3 patients from overseas for retreatment. 38% have treated 2 to 5 patients, and 14% have treated more than 9 patients. There's many reasons for this. I mean, the first thing is people that probably can't afford procedures in this country tend to go overseas, and as a consequence may cut short the recovery time. Some of them are coming back to Ireland or Britain just to get their stitches out after facelift procedures. And obviously, if they're going as far away as South Africa, they increase the risks of having deep vein thrombosis, which is a risk anyway post-surgery.
Hello there, and you're very welcome to Shoiga and O'Shea.
Yes, indeed. Thanks for joining us. Now, 1/5 of Irish women and 1 in 10 Irish men say they'd consider having plastic surgery. But would they think again if they knew the number of botched operations are on the increase? Later, we'll be examining plastic surgery horrors and indeed...
And this is take away the confusion that most Irish people have regarding this. One of the problems in Britain and Ireland, unfortunately, is the fact that just because you have qualifications in plastic surgery doesn't necessarily mean that you have any cosmetic sort of qualifications.
Okay.
There isn't established Royal College cosmetic surgery procedures or examinations. So a lot of people, after they get their plastic surgery qualifications, do add on courses. And one of the things that we've asked the government to do, not only in Britain, but in Ireland, but also in Britain, to have it like other countries to an extent, that you have SHOs, registrars, senior regis, people doing 3 years courses just specialising in this to bring it from the outside into the sort of the normal sort of paths of medicine and have examinations in it. And this is the reason why a lot of general surgeons can come into this country who may have done 500 facelifts, and a plastic surgeon in a public hospital may not have done one. Where would they get the chance to do it if they work in a public hospital?
Sure.
Because facelifts just aren't done there.
Okay.
So it's time we all, I think, grew up and matured about this and made it an established branch of medicine.
Marie, would you agree with all of that?
Absolutely, absolutely. Rejuvenate, actually, which is, I'm managing editor of Rejuvenate, which is Ireland's first and only cosmetic surgery magazine, but it actually emanated from another health magazine that I had, and we were constantly getting emails and phone calls from women and men in relation to where they should go for surgery, or would we recommend anybody? Obviously we weren't, and that's how the whole idea emanated. So I have to say at Grass...
So what's your role in Rejuvenate?
In my role in Rejuvenate, okay.
No, what's the role of Rejuvenate? What service do you provide?
Okay, our main thing with Rejuvenate was to educate. I mean, we cover, insofar as we get some of the best surgeons who write about different procedures every issue, but we took a very, very mature approach. There's like 16 pages in the last issue on questions that you should ask yourself. I mean, we will be calling for regulation in the next issue and going into detail about it. And a lot of people might think on a consumer magazine that may read very boringly. It was very important to us from the beginning. So like 3 months ago, we actually laid out a set of rules that if somebody was going in, these are the questions to ask. These are the websites that you go to. These, if you sit down with your practitioner, make sure it is the person that in the consultation that is performing the procedure, how many times they've done this operation in 1 month, not an entire whatever. So there's about 20 questions, and we will be repeating that next issue, and also setting a poll, an online poll, so the readers will be able to communicate with each other.
Do you think that the risks are underplayed and that some people don't treat it as seriously as they should?
Absolutely not. I think what has happened is you can go, when you're doing research, the whole backbone of Rejuvenate is information is power. I think we've done a very good job in that. And I know for a fact that there are women and men who have gone for, and I might point this out, this is really important, both invasive and non-invasive. Both are, every form of surgery has a risk.
Sure.
And everybody should look at the reasons. We even actually, every issue, have a psychologist who comes in and writes articles in relation to the reasons why you should ask yourself why you're having any form, whether it could be self-esteem issue, it could be breakup of a relationship. So it's education. That's what we do.
Joe.
Well, Susan Daly, what do you think is this new nip-tuck culture that we seem to have developed in Ireland maybe in the last 5 years or so? What do you think it's all about?
Yeah, I know what you're saying. We were looking at the picture there of Michael Jackson at the start, and that used to be what Irish people's only exposure to plastic surgery was. We were like, God, that's so extreme. You couldn't imagine yourself in that. I think if I was sitting here, sitting at home watching the television now, I'd actually be listening to these really sensible, experienced, professional people going, oh my God, is this our reality now? And it appears to me that obviously cosmetic surgery is going to need regulations if it's becoming a fact of life. But I think what we're missing here is the fact that it's actually, it's just been pushed so much as a business. It's worth, what, 20 million or something at the moment. That seems small enough compared to other industries in Ireland, but it's obviously growing. I mean, that's a fantastic magazine, but it is at the same time glossy and dedicated to something.
We don't hear about the risks. We don't hear that much about the risks, do we?
Yes, exactly. It's being pushed almost, to me, it seems that it's being presented to people as a lifestyle choice. If you feel bad about yourself, this is how to make yourself feel better.
There is a sense of reality. It is happening, right? Every article on